Dr. Osagie Ehanire, Minister of Health, says achieving the 27% contraceptive prevalence rate by 2024 is possible. Ehanire said this while launching a book entitled Family Planning for a More Productive Nigeria at the ongoing Nigeria Family Planning Conference 2020 in Abuja.
The United Nations Population Fund, the Department of Foreign Affairs and Trade Development, the United States Agency for International Development, Foreign, Commonwealth and Development Office, and other benefactors of Nigeria's family planning program who contribute to the family planning basket funding that supports procurement and distribution of family planning commodities since 2011, and other stakeholders. And I congratulate them all and others who have identified with this cause. I urge you to sustain the tempo to achieve modern contraceptive prevalence rate target of 27% by 2024. I believe it is possible.
Mrs. Pauline Talon, Minister of Women Affairs, pledged the ministry's readiness to continue to collaborate with the Ministry of Health and relevant partners to provide care and reproductive health services to women using family planning.
I'm sure you appreciate my being here, and we will continue to work together to help and make health issues to be top on our agenda. Mr. President is fully committed, and we appreciate what he's doing to support the Ministry of Health to ensure that the lives of our women and children are safe.
Emir of Shonga emphasized the need to close the gap in the zero preventable maternal death, zero unmet needs for family planning, and zero unmet needs for gender, and zero unmet needs for gender-based violence.
If you look at population control, I think the word that's imagined as better alternative is population management. It encompasses everything, the common sense. Now, it encompasses one small area which has been a problem for a large number of people: Sharia rights. But if you approach it from the health point of view, your wife has got 5 children. Don't add more. Because you have promised as a Muslim to look after your wife. You've promised as a Muslim to look after your kids. If you now fail to look after your wife and say, God will provide, no, you're weak, you're wasting on it. God has asked you to look after her. So you enjoy her, she enjoys you. Your children also should be looked after. They have a right on you. If you combine these ideas together, you can talk to any Muslim.
Country Representative UN Population Fund said access to family planning could reduce maternal mortality rate by 25%.
I think one of the key messages is that family planning is an enabler. It goes way beyond spacing the number of children you have. It is one of the key enablers to reaching the Sustainable Development Goals. Access to family planning alone is likely to reduce maternal mortality by 25%. That's a huge number. That is definitely a story we should change, and a legacy to give on to the future that we could be proud of.
Chairman, Technical Management Association for the Advancement of Family Planning, reeled out the successes of the association in advancing family planning.
5 successful conferences over the past 10 years, doing that every 2 years. We have successfully also advocated to government to put money down as counterpart support for FP commodities purchase, increasing the total support to $4 million and to make services free in public sites in the country. We've received grants from credible donors to do some of our programs. We have established accountability scorecards on FP funding. We have also trained civil society organizations on tracking and accountability at the sub-national level.